Good afternoon and welcome to the latest in a series of seminars from the Global Brain Health Institute and Respond on the topic of brain health and housing. My name is Anya Kerr. I'll be your MC for the next 2 hours as we hear from a range of research and design experts, practitioners and thought leaders on the importance of the 3 big C's we're talking about today: creativity, connection, community. Today, we're going to ask and hopefully answer a range of questions such as, with a growing understanding of the life course risk factors for brain health, how do we take an integrated approach to building and supporting brain healthy communities for all ages? How can creativity be used as a tool for building and sustaining brain healthy communities? And how can the arts play a major role in bolstering brain health through creating community and easing isolation and loneliness? Finally, we're going to ask, how can these ideas be incorporated into our design and planning? Now, throughout the presentations and panel discussions, we encourage you to add questions or comments through the Q&A function throughout. I'll be monitoring them in real time, and as we break out into Q&As, we'll be asking your questions from you, the audience. The more questions that we get from you, the better, because we really want this to be an action-oriented session, which is hopefully going to generate lots of new ideas about today's theme: brain health and housing, creativity, connection, community. We also hope that through the conversations here today, we can think about and create new best practices and ultimately and critically influence policy change. We'd also love you to get posting across social media today about our contributors and all of their contributions, insights and takeaways using handles such as @RespondHousing and @GBHI_fellows using the hashtag brain health and housing. We'll take a short break for about 5 minutes at 4:45 so everybody can get caffeinated again and catch your breath. And with all of the speakers lined up this afternoon for the next 2 hours, I think you're going to see what is possible and why this partnership between the Global Brain Health Institute and Respond is just so special. And hopefully we'll be able to demonstrate a lot of new creative thinking, but how that can be applied in a very practical sense, and that you can really see just how important the collective is here today in terms of the learning and the case studies that are going on in our world without. Now, to formally commence proceedings, we're joined by Dr. Linda Doyle, 45th Provost of Trinity College Dublin. And Dr. Doyle's previous leadership roles have been as Dean of Research and founder of Director of Connect, a national research centre focused on future networks and communications. And prior to her appointment as Provost, Dr. Doyle was Professor of Engineering and the Arts in Trinity College Dublin. Dr. Doyle, you're very welcome. I'll hand over to you now to make some opening remarks. Thank you.
Thank you, Anya. Thank you, and I'm delighted to be here. I'm just going to put up a small few slides, which I know doesn't normally necessarily come with some opening remarks, but I just wanted to say a few things here today. So first of all, just to say, one of the things that we're most proud of in Trinity is the Global Brain Health Initiative. It's an amazing, I think, world-leading initiative focused on, I think, it's so amazing for 2 reasons. It's focused on one of the key things we need to think about, and that is brain health and dementia. And it's also the way the Global Brain Health Initiative goes about everything. It's just a fantastic organization that really understands the need to bring people from so many different backgrounds and perspectives together if we really want to make a difference and tackle something. So when you look across the fellows in the Global Brain Health Initiative, they come from all walks of life to look at brain health. And I think that is really, really important. I find it really exciting that the Global Brain Health Initiative is working with Respond on what is, for me, an amazing topic. And when you hear the phrases brain health and housing, and you think about creativity, connection and community, I think it just brings up so many different ideas. And I think it's testament to what a fantastic series of events you have, that you have something called something like this that's so compelling and immediately wants to make you know more. So all I wanted to do in saying a few opening words is make 2 points, and making the 2 points, I just wanted to reflect on an experience I had myself in doing that. So I had the privilege a couple of years ago of working with this woman called Ellen Rowley here on the right. And Ellen resurrected a series of lectures in Ireland called, they were the Thomas Davis lectures that used to be lectures on the radio by academics about really key topics in the country. And Ellen resurrected them and created a series of lectures called Davis Now. And she got me involved with a bunch of people. And a couple of years ago, the theme that she had for them was basically around housing and home. And the reason I bring these up is she eventually created a series where we all gave different lectures, and the series was called Making Home. And the key thing for me in that was that series drew on architecture, politics, theatre, economics, art, history, sociology, technology, and much, much more to understand notions of home. And it was through working with those other people from those multiple of backgrounds that I think, for me, I saw the importance of how you can only really understand home from so many, by bringing these different perspectives together. And I think one of the key things in this for me was also the name of it. So this notion of making home. So home is much more than a house, and it needs to be made through, I suppose, all the actions and all the ways you go about, I suppose, engaging with the home. I think that came home really, really strongly to me, no pun intended. And the second thing I think I just wanted to point out here, there was one of the lectures given by a woman called Michelle Norris, actually played on this title, and she talked about unmaking home and about how, for example, we often reduce home to a housing market as distinct from a place of shelter, a place of culture, a place of learning, a place of being, and a place of identity, and much more. So we didn't have the foresight at the time to think about brain health and housing and home. And I'm sure it would have absolutely added to this, but I just make this point here because I think what you're doing here today is absolutely fantastic and capturing the spirit of that interdisciplinary need and that spirit of creativity that you do need to unpack what it means to create sustainable housing and housing that's based on the notion of brain health. So I just wanted to, I suppose, say, I'm so delighted to see that, and having had a little taste of it in this Making Home series, I kind of look forward to much more through the seminar today. The second point I wanted to make, I suppose, draws on my own background. So as Áine said, I was Professor of Engineering and the Arts, and I worked a lot in technology. And in this particular series, I gave a talk about smart homes. And a lot of the time when people talk about smart homes, they talk about them in terms of how we live our lives and how our home is sustainable and environmentally friendly. But very oftentimes you hear people talking about aging in place, and you talk about how do we create the smart home so someone can go on and live independently and live their lives forevermore in that place and space, and make the choices and have the autonomy that they want. So in the lecture I was giving back then, I was also talking about aging in place and the smart home in that role. But it was through working with the other people and the other people on that specific event that made me think, I suppose, in a different way about it. And I just wanted to kind of bring up one point from that. And it's kind of a random point to be pushing out here by words of introductions, but it, for me, summarizes a lot of, I think, what I want to say about today. So doing that series of lectures made me realize the smart home can replace things, and it can replace forgetting, or it can replace remembering. And let me explain what I mean by that. And I've kind of written down there, it can replace forgetting by connecting a person who's alone in a home with the wider world for their benefit. So the smart home can be a home by which it's connected to the wider world, like in maybe through COVID times where we're networked out there and you're not alone. But it can also replace remembering by using technology to let us off the hook for caring. So in other words, you can put somebody into a smart home and say, my duty is done, I'll be notified if anything goes wrong, the person will be kind of monitored, and it can remove the need for kind of, or badly replace the need for that kind of social interaction. And I say this because I think, to make the point that I think when you look at anything, when it comes to housing, when it comes to brain health, when it comes to creativity, when it comes to connection, when it comes to community, there are so many choices we can make in the world for designing homing, designing housing, thinking about sustainability that have two sides to them. And one of the things when I look at this symposium today, when I look at what you're doing and bringing people together, I think you're doing things to make sure that the voices are heard from across the disciplines and across the different levels of expertise, to make sure when we make choices for the future of housing, when we make choices for the future of home, when we make home in a sustainable way, that all of those multiple viewpoints are taken into account, and things can be done much better than we have done so to date. So they were the few words I just wanted to say. I just want to say as well, congratulations to all involved in this. Thanks to Brian Lawler and team, for being so creative in creating Creative Brain Week. And I very much look forward to hearing the others and hearing what everyone has to say. So thank you.
Thank you so much for that, Dr. Linda Doyle. And yeah, an important reminder there on just the importance of an interdisciplinary response and approach to all of this, and hearing the voices so we can think about all of the consequences of our designs and plans. So thank you for that. I'm going to introduce now Declan Dunn, who joined Respond as Chief Executive Officer in August 2016. Declan's previous role was Chief Executive Officer with Sophia Housing Association. He served as Director of the North Dublin Development Coalition at DCU for 9 years. He was a non-executive Director of the Ballymun Regeneration Board for 10 years and was a Director of Ballymun Whitehall Enterprise Centre for 10 years. Declan was Chair of the Housing Alliance from 2018 to 2020. Declan, I'll introduce you now to make some opening remarks as well, please. Thank you.
Thanks, Anya. So thank you, Anya. Can you see me or hear me?
Yeah, you go for it, Declan.
Great. Great. Thank you very much. So thank you, Anya, and thank you, Linda. That was really interesting, Linda. I enjoyed it immensely. And this is a great afternoon to have a rest and enjoy something creative and positive. So I'm really looking forward to it. And a lot of what you said, Linda, about home really has resonated with me in the few words I wanted to make. So we are really excited about our collaboration with Trinity College and the Global Brain Health Initiative with Brian and with Ian and all the fellows. It's really been an inspiring time for us, but very practical for our mission. So Respond's mission is to build homes and improve lives, not one or the other, but to do both of those. And that's a challenge. And the building homes bit, you might think is a bit of a challenge, and it is, but it's going quite well for us. We've built we've been in existence for 40 years, where we now own 6,500 homes around Ireland. We've delivered recently 1,300 homes, and we have 1,560 homes in construction today, with another 2,225 approved by our board to be built. So in doing that, of course, we have to think about, so what will it be like to live in those homes? And what will it be like to live in those neighborhoods and communities? So an interesting part about our work is that only half of our staff are involved in the building houses side of it. We're very fortunate in that we've got a team of over 20 architects, planners, quantity surveyors employed directly, and lots of other professionals, legal and accounting and all the rest you'd expect. But the other half of our staff are involved directly, employed by us directly, and involved directly in delivering services. So we run 17 early year services and after school projects for children, obviously. And we run elder care services, particularly for people later age who face the kind of challenge that GBHI is interested in. And there are two beneficiaries. They benefit by attending 1 or 2 days a week, and nurse-led services with a lot of additional activities and food and all the rest provided, but it also provides support for their carers. It gives them a day or 2 a week for them to do the things they need to do. So in all of our activities, whether it's those services or family support services or supporting program refugees from Syria, which we also do, we're thinking about outcomes for people and how that would work. So before our last conference, I met with Ian up in Trinity and had a really interesting conversation, and as always, and he said something to me that kind of struck me. He said that we found that in many cases, socialization and activities and creative pursuits can be more helpful for your brain health than giving up some of the things that we think we should give up, like smoking and drinking and things like that. That shook me quite a bit. And then I started to think about our activities and the things we try to do in our neighborhoods and so on. And for many years, in communities around Ireland and other parts of the world, people have been involved in what is generically called community development activities. And often this is not necessarily valued. It's considered to be ad hoc activities of a questionable merit. And, where is the evaluation? Is there any, science behind it? And how do you know what the outcomes actually are? So to hear that there is a basis that purely through people being involved in their activities, whether it's mothers and babies clubs, whether it's older people getting together in the afternoon or youth clubs or whatever, the socialization itself, the act of engaging with others and being stimulated by others, particularly in relation to creative pursuits and stimulating pursuits, is good for your brain. The second thing I wanted to say is a good friend of mine, Ray Yates, is speaking later on. And I met Ray when I was on the board of Ballymun Regeneration. Ballymun Regeneration would be the biggest regeneration project in Ireland, possibly in Europe at the time. It was €1 billion. And that project was basically high-level housing, high-rise housing, where there was an agreement between the people who lived there and the state that actually people didn't want to live in high-rise and that they wanted to build entirely new stock of housing and facilities to support them. And amazing as it is, that community decided that the first thing they wanted before a single house was built was an art centre. And out of that, my own organisation was involved in making an application to Europe and building an art centre, which Ray was the first director of. And that centre provided a theatre. It's still very successfully operating at the moment. Arts centre, dance centre, all sorts of a huge range of activities, and also is involved in providing creative support for children in schools. And that has been the biggest success story of the Regeneration Project. So that community had decided that's what it wanted to do, and it had a really big impact on the well-being of everybody there, and that regeneration became more successful for it. So the final thing I just wanted to say is that in our work with Brian and his colleagues in GBHI, we are already looking at picking a particular site for next year to build our first brain healthy neighborhood. So we're really excited about applying all of that in a very specific location. So thank you very much.
Great. Thank you so much for that, Declan Dunn, CEO of Respond. And a reminder to everybody who might just be joining us, we encourage you just now as we start to go into presentation mode, get your questions in. You just have to go and hit on the Q&A function. We're monitoring them here in real time. We'd love to get you posting across social media using the handles at Respond Housing and at GBHI_fellows using the hashtag Brain Health and Housing. Now, to introduce our first speaker of the afternoon, Dominic Campbell is a cultural producer inspired by the effect on societies of longevity at scale. He's the co-founder of Creative Aging International. He uses celebration as a strategy to align understanding of aging and contemporary experience so more people might live better for longer. Dominic is a former director of the St. Patrick's and Bealtaine festivals. He's also an Atlantic Fellow for Equity and Brain Health at the Global Brain Health Institute. Dominic, I'm so excited to see this presentation that I know is all about building future healthcare from intangible heritage. I'll let you pull up your slides and take it away. Thanks so much, Dominic.
Thank you very much, and thank you for the welcome. I'm delighted to be here to talk to you about creativity, connection and community. In a fit of enthusiasm, I decided to call this Choreographing Spirits, Building Future Healthcare from Intangible Heritage. And I will be talking about ghosts and miracles and dancing. And so for those of you of an engineering or a scientific inclination, I offer a trigger warning and I offer you a scattergraph. The thing about creative practice is it roughly aligns with the line of best fit, although any individual data point may not be smack on target. So, ghosts. We live in the land, we live in the dreams of our grandparents, we live in the houses they built and the care systems that they put together. And sometimes, simply by longevity, they become misaligned, or we live within traditions that they created that may not be appropriate to our times. And when I think about my own work in creative practice, I think that that's about context and quality. We sometimes confuse the context with the quality. We think that the place with the red ropes makes better creative practice than the place down the corner, the community centre. And we inherit a healthcare system that's primarily an acute system. It does fantastically well at fixing broken bones. You go in, you're fixed, you go back. It's fantastic for that kind of practice, but not necessarily for mental health, not necessarily for living with the conditions of older age. And it has within it some traditions that maybe have lived a little past their sell-by date. It makes everybody patient. It gives over the responsibility for health to a professional within that environment, which it should do. But it's maybe not helpful in all areas of health. And it's based on certain ideas. It's based on the idea, like every healthcare system in the world, that it's kind of gendered and women will pick up the invisible care work. It's based on the idea that there will always be people that will come from somewhere else that will support our healthcare system with their intelligence, because that used to be us. If I think about housing and its incredibly complicated role in the lives of Irish people, I think about those people that used to go away. And I think about their need for safety and security. And I think about housing not just as bricks and mortars, and as the proverb says, much more about care and a place of safety. And these stories that we tell ourselves about people and about ourselves and about other people and about the places we live are incredibly important. The neuroscientists, the people that study the ideas about self, how we tell ourselves who we are, explain to us that stories are critical. And the stories that create division between people or practices are also incredibly important unless we pull back a little bit and take a different view. And from this distance, the divisions between people seem less important, rather than the intention of what it is we're trying to do. Don't we all want to live better for longer? And from this distance, we can see that actually miracles happen. People do generally live better for longer. They live better because of fresh water. They live better because of the eradication of communicable diseases. They live better because of education, particularly the education of women. But it's an inconsistent miracle. And there are certain things within that living longer that we really have to question. And that leads me to the second miracle, really, which is that people are beginning to do that in very interesting ways. So in the Global Brain Health Institute, for instance, the way that they think about creative practice is in terms of 5 pockets. They think about how scientists and artists and communities and journalists and lawyers engage with creative practice. And they say, well, there's sense making. How do we make sense of the world? There's engagement. How do we connect with each other through dance? How do we connect with each other through music? And there's really genuine and deep exploration. How does a dancer work alongside a neurolinguist? How does the two of them together find ways of exploring and making sense of the world in which we live? There's advocacy, which is how do we take the good science and communicate it? How do we raise the attention and profile? And there's transformation, which is largely where my own work sits, because I'm particularly interested in how culture cuts across the individual, the community, and the environment, the ways in which it does that through the creation of cultural normacy or through information or motivation. And my laboratory is creative practice. I think of it as a kind of dance. Celebration is often my strategy. And so I'm going to talk about that in a little detail. This is the work of Kunle Adewale in Lagos, Nigeria. It's a kind of project you might be familiar with. This is the mental health unit in Lagos, as it was, and as it is now. As it was, and as it is now. A lick of paint and a bit of imagination creates a space in which people feel that they're valued and it's important. And you can see these kind of projects all around the world. This is the work of the Irish Hospice Foundation, the Design and Dignity Programme, which is creating spaces for conversations about death, dying, loss and grief in acute hospitals. And when it was evaluated, one of the things it recognised that actually the impact was as much on the staff and the people that work there, because it creates places that make it slightly easier to have difficult conversations. It creates spaces that people who work in those institutions are proud to show off. And that when you embed that practice in the behaviour of a hospital, it becomes normal. It changes the culture of the hospital, it changes the way that it works. But I've started to wonder about this. What happens when we can change the culture of a healthcare setting, but it sits within an environment which is possibly negative to our own health? It might be that I'm LGBTQ in a place where the law doesn't support me. It might be that I live with a stigma-associated disease. It might be that the air or the water quality isn't really doing me any favours. So what if the society causes sickness? Back in the 2000s, this is the kind of work that I would have done. This is 24 searchlights around O'Connell Street that people could operate from domestic computers at home, and 15,500 people around Europe did, to make 3.5 mile high searchlights. And I was playing with, through the medium of a festival, through the medium of an event, placemaking, and who got to shape those places and what they were for, and also how those stories would be taken up by wider media and became part of a national culture and a national narrative. I was playing with what happened if you put fireworks into Docklands, which at the time was a development site, and invited people into an area that had a particular story. Would they change the story when it was layered with fun and pleasure and celebration, and you stopped the city and turned it into a place for play? And when you changed the recognised association of who got to be Irish and where, and who was part of our culture and our tribe and our group and who we cared for. And one of the things that happened is you could create a sustainable program because it made money for people, which allowed you to experiment. And within this, I would commission artists to work in places with difficult postcodes so that those kids could dress as kings and queens and walk down the street and say, this is my city and I belong. And I have impact and influence and I can change what happens here. And I took that theory and that way of working to working in the Bealtaine Festival, which is focused on aging and creativity as we age. And gradually over time, that festival grew in exactly the same way that all festivals did. It has content, it has creative work, it has a promotional function. Lots of people were involved in it. And outside of the festival period, we would take people that were involved in it, and on a very local level, we would have conversations about what they'd done and what they wanted to do. We'd have the GP and the librarian. We would have the arts organisation, the arts officer. We would have the Mrs. O'Brien from the Active Retirement Group. And then we might bring Mrs. O'Brien to Donegal to meet Mrs. O'Reilly, where they talked about the fantastic things that they were doing. And they celebrated their achievement in their own community. And we did that because it was built originally by women like this. So in the 1970s, were negatively impacted by laws and legislation like the marriage ban. And they knew that what was critically important for them, they felt in their bones that was important for them, was fun and companionship and friends and all those things that neuroscience is now recognizing are critically important. That it isn't so much what people say as how they make you feel, and the arts is all about how they make you feel. And that's working from sensation and feeling allows you to do behavioral change and brings great benefit for health if you build community together. And so we continued in the same way with Bealtaine. This is a program called the Dawn Chorus, which invited older people to join choirs and sing on the beach at dawn. And it took place during the economic downturn, the economic crash. And what we realized was around the conversations about singing and what time you needed to be where was a conversation about resilience and how you lived through uncertain times, and that those events led by older adults were beginning to connect their community and build community knowledge. If you want to know more about Bealtaine, there's an economic review from Eamon O'Shea and Anya Lem. But I want to step from that to look at what happens on a local basis. So this is a project that we began in South East London. called Entelechy. And Entelechy is an arts class for older adults that works a bit like a youth care centre. And sometimes this is what people do, and sometimes this is what people do. It amplifies and extends through the propagation of joy. It's great fun. And within that, people are referred and recommended to it by GPs or adult social teams. They're people that are at quite difficult times in their lives. It was set up originally with the stroke unit. People come from families and friends. The red dots are the people that are technically the participants. The green dots are the people that are technically the volunteers, but sometimes it becomes very uncertain who is who, because everybody in that room, including the blue dots, which is artists, is in a journey. And if we think about the participant pathways in that project, it's quite often about identity, going from being defined as a patient to being defined as a poet or a singer, as someone with a wider social circuit, with meaning, identity and purpose. And over time, we grew those across the borough. And we did them from artist residencies, and we did them from in youth care, in youth centres and in all sorts of places. And really that's informing the work that we're doing now, which is asking, how do we build a republic that has care at its centre? How do we build on living traditions? So this is a photograph of the Bluebell Community Centre in southwest Dublin, an area with high measures of social deprivation, poverty, which is gradually changing. And one Friday I stumbled into this place to find 80 odd people having a subsidised breakfast, and they're people from anywhere in that community because everybody is welcome. And I sat and watched and thought, could I introduce an arts project here that wouldn't mess up the glory that I was sitting in? And actually then I thought, how do I tell the rest of the city about this? Because this is a thing that we should celebrate that's being built in our community. And so working with the singer-songwriter Sean Miller, gradually we interviewed people, we wrote tunes, we shared them back with people until they were happy with a song about themselves. We introduced musicians, and eventually people sang those songs that were made about their own lives on the stage of the National Concert Hall. And people think that's where this project peaked, but it's not. Where this project peaked was because it encouraged people to express themselves, and it became normal that somebody with a cello might pop up across from your beans on toast, that you might draw an explanation of what you're feeling or what you are sensing. And we built that out over the pandemic with a project called Aging Voices with Sing Ireland, where we did a national audit of singing around the country, people that sing in their local choir. How can people as they grow older be encouraged and supported to stay in their choir? When people sing that have a degenerative disease, how can they be supported and maintained? What education do the people that run those sessions need? How can nurses be encouraged to sing for care? How do communities connect through the process of singing? And currently, I'm working with the Irish Hospice Foundation with 7 places around the country that build on this learning. So we are inviting people to bring their loss. We're creating places where people can tell stories about loss as an anchor within a community for that community to rebuild from COVID. And so all of those projects are now forming as we answer this question about how do you build a republic of care. And what we recognise is that acknowledging ghosts is necessary and demands space. You have to make space and time for people to have those conversations. That it's a process of iterative learning, that you learn with each development. As Declan said, learning from Axis, learning from Ballymun, learning from what's been built already. And that the emotional circuits are critical in this process. Emotional circuits aligned with the decision-making circuits in human brains. We're not separate from the projects that we develop, we're part of it. We can build back in ways that are more beautiful than they were before. As Sean Miller, the artist on the Bluebell project, said, we're not shying away from making these songs, making it big and epic. We're told that there are important stories and there are unimportant stories. I suppose what I'm saying is that all stories are important. Everyone's life deserves an orchestra. Thank you.
Thank you so much for that, Dominic. That was at one inspirational and yet so pragmatic in terms of kind of demonstrating the art of what's possible when we have design and dignity really to the forefront of all we do. and think about. And just to say to everybody who's watching that and hopefully equally inspired, do keep questions coming in through the Q&A function. We'll have time to ask Dominic questions about the series of projects and a lot of his thinking there at the end of the 3 presentations. We'll go next to Alexandra Coulter, who's the director of the National Centre for Creative Health. Its mission is to advance good practice and research, inform policy and promote collaboration, helping foster the conditions for creative health to be integral to health and social care and wider systems. That National Centre for Creative Health was formed in response to recommendation 1 in the Creative Health Report. That's the result of a 2-year inquiry by the UK all-party parliamentary group on arts, health and well-being. Alexandra, you're very welcome. We're looking forward now to your talk, which is titled Culture, Creativity and the Social Detriments of Health.
Thank you very much, Anya, and great to follow Dominic. I'm just going to share my screen and get my presentation ready. So thank you very much for inviting me to speak. What a fascinating mix of people, also a rather challenging subject. When I first heard the title, I wasn't sure that I had much to contribute, but anyway, hopefully what I have to say will be useful. As it says here, and as Anya says, I'm director of the National Centre for Creative Health, which is a UK organisation, and also I continue as part-time director of Arts and Health South West, which is a regional learning, advocacy, networking and development charity working across the southwest of England. As Anya said, this is some background to the establishment of the National Centre for Creative Health, which was launched in March 2021. The All-Party Parliamentary Group on Arts, Health and Wellbeing was formed in 2014 by Lord Howth of Newport and parliamentary colleagues. I took on the secretariat on behalf of what was then the National Alliance for Arts, Health and Wellbeing and is now the Culture, Health and Wellbeing Alliance. And we conducted a 2-year national inquiry, which resulted in the Creative Health Report, which was launched in Parliament in July 2017. So the key messages in the report are here on the screen. The arts can help keep us well, aid our recovery and support longer lives better lived. The arts can help meet major challenges facing health and social care, ageing, long-term conditions, loneliness and mental health, and the arts can help save money in the health service and social care. A significant milestone for us was when Matt Hancock, then Secretary of State for Health, included these key messages in a speech at the King's Fund Social Prescribing Conference in November 2018. He announced the establishment of the National Academy for Social Prescribing and placed social prescribing at the centre of the prevention agenda and the arts at the centre of social prescribing. He did adapt our key messages to say the arts and social activities can. Our use of the words arts was intended to be interpreted broadly. However, I am finding that the term creative health has more traction, particularly with health professionals. And of course, the word culture holds broader meaning than arts for most people. There are 10 recommendations in the report and each targets a different part of the system, including health systems, education and research. And recommendation 1, as it says here, was that leaders from within the arts, health and social care sectors, together with service users and academics, establish a strategic centre at national level to support the advance of good practice, promote collaboration, coordinate and disseminate research, and inform policy and delivery. At the National Centre for Creative Health, we have a number of strands of work related to integrated care systems, which is very much an English health structure, co-production and research with a focus on health inequalities. I should add that the illustration on the right and those in other slides are by David Shrigley, who we commissioned to make some drawings in response to the stories of people with lived experience who were involved in the inquiry. If we focus on the social determinants of health and the challenge of health inequalities, how might we consider the role of creativity, connection and community in mitigating disadvantage, and can this be linked to brain health across the life course? The theoretical underpinning for the Creative Health Report was the work by Professor Sir Michael Marmot on the social determinants of health, which by 2017 was widely accepted both here and internationally and reflected in health policy documents. Chapters of the Creative Health Report considered the evidence, policy, commissioning and funding, and place, environment and community. And then the substance of the report is structured around the life course, which reflects Marmot's approach. Marmot's seminal report, Fair Society, Healthy Lives, the Marmot Review, published in 2010, makes no reference to the arts. Creative health aimed to bridge the gap between strategies to tackle the social determinants and an acknowledgement of the role the arts can play. We asked Michael Marmot to endorse the Creative Health Report, and he gave us this quote: "The mind is the gateway through which the social determinants impact upon health, and this report is about the life of the mind. It provides a substantial body of evidence showing how the arts, enriching the mind through creative and cultural activity, can mitigate the negative effects of social disadvantage. Creative health should be studied by all those commissioning services." However, it is frustrating that he doesn't consider the role of the arts, creativity and cultural engagement, even within his subsequent reports. His work focuses on the data and evidence which identifies the problem rather than on solutions. In fact, on those measurements, everything has deteriorated in the 11 years since his first report, and COVID has, as we all know, made inequalities even worse. The Marmot Review 10 years on, which was published in February 2020, showed that people can expect to spend more of their lives in poor health. Improvements to life expectancy have stalled and declined for the poorest 10% of women. The health gap has grown between wealthy and deprived areas, and that place matters. Living in a deprived area of the northeast of England is worse for your health than living in a similarly deprived area in London, to the extent that life expectancy is nearly 5 years less. He has also done two recent reports which have considered the impact of COVID-19, and he works closely with the Health Foundation, who generated this infographic. These reports help us to understand where the problems are, but we need to consider how cultural and community assets can be used to mitigate these negative impacts. Sorry, just go to the next, that's it. So in the Creative Health Report, there is a section on environmental adversity in the chapter on the arts and the social determinants of health. It discusses how the impact of negative stress, which debilitates and hampers human flourishing, has a negative effect on biological pathways and cellular function. Now, I'm very aware that there are people in the audience who know a great deal more than I do about this subject, but I just want to draw out the central argument in the report related to the social determinants. So the examples in the report given include how data on more than 60,000 people demonstrate a direct link between psychological distress and cardiovascular disease, and how adverse childhood experiences such as trauma and abuse increase the likelihood of chronic illness and shorten life expectancy. However, it also notes that the social determinants are mutable and poverty is not destiny, to quote Marmot, that environmental enrichment has been found to improve cognitive functions such as learning and memory and increase willingness to explore. There are instances of the arts contributing to improved environments and helping to overcome stress, and the report states that arts engagement may be envisaged as a factor that can mitigate the effects of health inequalities while policies are implemented to eradicate their causes. Marmot identified 6 specific policy objectives, which include create and develop healthy and sustainable places and communities. If we're to consider a whole system, ecosystem, or place-based approach to communities and the conditions in which we are born, grow, work, live, and age, we know that we are in complex territory. The challenge of bridging disciplines, evidence methodologies, structures, and language when we are looking at a whole system approach is daunting, I think. But place-based thinking is helpful in this, and it's a phrase that, at least in the UK, now bridges cultural policy and health policy. So from a neuroscience point of view, to quote Michael P. Kelly in the Journal of Social Neuroscience, The external environment and the way it interacts with inter-individual processes is, we suggest, as important as the intra-individual processes themselves. The external social and physical world is not just there waiting to impact on inter-individual processing and modelling, either in a deterministic way or in a process akin to osmosis. Humans actively engage with the external world, and in that engagement are constrained by it in various ways. The 3-year programme of research on mental health and social, cultural and community assets led by Dr. Daisy Fancourt at University College London, the March Network, has gathered evidence on how social, cultural and community assets prevent the development of health conditions, help people manage and treat their symptoms and promote health promotion. Crucially, these benefits are felt by people regardless of factors such as their demographics, socioeconomic status and other health conditions and behaviours. However, we can't assume that people will access cultural opportunities even if they do exist in their locality. And people living in areas of higher deprivation are less likely to engage in community activities. But if they do engage, it can have more benefits for their mental health than people in more affluent areas. So COVID-19 and the connected research has raised the profile of the importance of creativity for individual resilience and to support communities in crisis. There are many heartwarming and inspiring examples. The Culture, Health and Wellbeing Alliance collected case studies from 50 arts, culture and heritage organisations targeting people shielding or vulnerable at home during COVID, with a total reach of over 100,000 people. And interestingly, I think here, 94% of those were conducted in partnership, and that is absolutely critical. And it's absolutely critical that we keep those connections going and that they are sustained as we move out of COVID. All that has happened over the last 18 months has helped open up traditional structures and long entrenched policy orthodoxies in the field of health. Much of the work we need to do, I believe, is in helping foster the conditions for creative health to be integral to health and social care and wider systems. And recent publications on health inequalities recognise the significance and potential of place-based approaches and the importance of the voluntary community sector. This is a table from a UK government report called Place-Based Approaches for Reducing Health Inequalities, which was last updated in September. And in that it says that health inequalities stem from variations in the wider determinants of health and the presence of or access to psychosocial, mediating and protective factors. And interventions that solely rely on individual behaviour change are likely to widen inequalities, given the complex causal pathway impacting on capability, opportunity and motivation to change. So individual characteristics such as control, self-efficacy and resilience, as well as the social characteristics described as social capital, such as social networks, can protect health from the effects of stressors in some circumstances and thus positively influence health outcomes. I think protective factors is a key consideration when we look at the potential for culture and creativity to contribute to mitigating the negative impacts of social determinants. Very briefly, my sort of closest contact with this area of work is an estate in Weston-super-Mare, the Bourneville estate. And that brings together some of these issues of place, poverty and health in a social prescribing project. In the most recent indices of multiple deprivation in England, an area in this estate was ranked 120th out of 32,844 lower layer super output areas in the country. In the policy documents about health inequalities, there isn't a discussion about the language we use or the impact on these places once they are identified as deprived. As the author Lindsay Hanley writes, based on her own experience, council estates have the effect of making people feel worse about themselves and in turn physically worse than other members of society. Actually, this image on the left comes from a newspaper article which has the headline, "How a once notorious Weston-super-Mare estate has become Somerset's most connected community." On the right, there's a drawing for Ebbsfleet Garden City, which is a healthy new town in the Thames estuary. And obviously there is always this hope that with a clean slate, things can be different. Time will tell with Ebbsfleet, and they have an impressive long-term plan involving the arts and creativity at the heart of community development. We have recently commissioned some work on integrated care systems and cultural activity, and this included a very useful case study on Ebbsfleet. Arts Council England is also attempting to redress the balance of a public funding for culture to places which have historically low investment and higher levels of deprivation. They've selected 54 places to focus on, all of which are also relatively high on the indices of social deprivation. So obviously we get this combination of lack of access to cultural offer as well as social deprivation. So if we just briefly think about the life course, people are obviously at the heart of all of this and interacting with each other and their immediate environment. And good relationships are a major determinant of health. And as the Marmot Review told us, the foundations for virtually every aspect of human development, physical, intellectual, and emotional, are laid in early childhood. Children who grow up in poorer families are more vulnerable to heart disease, mental health problems, obesity, respiratory disease, and stroke than their more affluent contemporaries. Housing quality correlates with mental health. And Creative Homes, an arts organisation based in London, identified the home environment as key to a child's healthy brain development. They facilitate live experiences in London homes, including households in social or sheltered housing and dependent on income support, with one or more children under 5. An analysis of their impact showed a 64% improvement in the quality of household routines, a 23% increase in play at home, and a 27% increase in singing with children. Oops. I'm not going to talk about at the other end of the life course, because I know that's very much the specialism of many of you involved in this symposium. But I always love this image, which comes from Live Music Now's Songs and Scones programme, which brings together older people who live on their own in the community or in care homes for an afternoon of music, tea, and conversation. Singing is good for us in so many ways, from respiratory health to social connection. And just a little quote here, which I will contextualize, and I really like it. As part of a project exploring the civic role of the arts, community musician and storyteller Sal Tong held a series of creative conversations around group singing with people with dementia in Shropshire in England. The resulting film helps us to understand the ways in which artists, to quote the film, animate the human infrastructure of society. And I'll just finish with another quote from Grayson Perry, one of those artists that helps us animate the human infrastructure of society. And I think this goes back to some of the things that Dominic was saying, that art helps us access and express parts of ourselves that are often unavailable to other forms of human interaction. It flies below the radar, delivering nourishment for our soul and returning with stories from the unconscious. A world without art is an inhuman world. Making and consuming art lifts our spirits and keeps us sane. Art, like science and religion, helps us make meaning from our lives, and to make meaning is to make us feel better. Thank you.
That was superb. Thank you so much, Alexandra Coulter, Director of the National Centre for Creative Health in the UK. And just a reminder for those of you watching and you're looking at some of those examples from the UK and wondering about the learnings from the Irish context, do get your questions coming in the Q&A function. We will have 10 minutes for questions coming up at 4:35 immediately after the next speaker. Thank you so much for that, Alexandra. Now, the third and final speaker for this particular part of the session is Ray Yates, and Ray is the City Arts Officer for Dublin City Council. He has worked in the arts for 40 years, and he is formerly the Director of Access Ballymun, Deputy Artistic Director of the Abbey Theatre, and Artistic Director of the Chelsea Playhouse in New York. Ray, you have a talk for us that's titled Creativity, Disruption, Wellbeing and Risk. Take it away. Thank you.
Thanks very much. And I think you're sharing my slides for me. So if you can go ahead and do that. I'm going to take a bit of a risk as well, maybe, because I use the word risk in my title. And I'm going to read a poem. I'm still involved as a practitioner. So I'm going to read a poem I wrote called No Questions. No questions. I will live this year in the town of no questions. Traveling through Hope Junction, trudging through Anxiety Falls, respite at the base camp of self-care, before the attempt on Peace Ridge, ascending now and forever. I'm always welcome here, and no one thinks to ask me where I've been. And as this is the most sought after destination, everyone knows that no one ever leaves here entirely or entirely of their own accord. I look for old friends, and many are still here, still smiling. Still, I watch the day trippers moving fast as they can to consume Peace Fudge and Serenity Rock before the cable car leaves at 4. Everyone is so kind to them because they know, and we know, that they could stay forever if they wanted to, but they must away. We keep the rules here at Peace Ridge, above the town of no questions. Sleep and real compassion for our dreams, exercise and eating well. And when the compulsions come, born of old fears and comparisons, bred from willful mistakes and mental health difficulty, they are well met. And we sit quietly with them. We love the questioner. We let the questions go. So it's kind of good to start on something that is an attempt to create art, because artists are not going to accept the easy answers of the logical mind. And the first thing I think artists are interested in doing is disrupting, not willfully, but simply because of the way their own brains work. And most of my career now is explaining or negotiating for the arts with people who are not working in the arts. And the arts are kind of divided up into 3 main areas. One, there are practitioners. There are people whose it's their vocation or practice, and indeed often their livelihood, to practice one of the art forms. They're musicians, actors, playwrights, poets, all kinds of writers, painters, contemporary visual artists, etc., etc. And then there are people who want to participate in the arts. And I think that there's a lot of discussion in the great presentations before me about people participating, like joining a choir, interacting with an artist to write a song about their life. That we kind of call that participation, getting engaged in the arts on a regular basis, but nobody's thinking of maybe turning it into their day job. And the third part, a really important part, is the idea of audiences, because we all join audiences at different times. Audiences are under real threat at the moment. Certainly live audiences are, because of the pandemic. But the ability to sit and engage with a performance, a piece of music, to listen to a book being read on the radio, to sit and read a book yourself. All of these things became incredibly important during the pandemic in a way which surprised everybody. But I don't think it surprised anybody working in the arts, because anybody who works in the arts knows that the arts were a lifeline for them first, before they made them a lifeline for anybody else. Because I think sometimes people describe the personality as the grab bag of survival strategies that you've developed to escape childhood. And certainly the arts was that for me. It was a place to go that was safe. It was really great fun, and it was expressing something deep that couldn't be put into words, but often was expressed by the words of other writers, or the music that I was given to play, or the books that I was reading. And we often don't have a language for our difficulties, but the arts can provide that and can provide a safe space. Like it was well known when in Ballymun that we could say things on the stage that we couldn't say 5 feet away because they were being said by a character. So disruption is an incredibly important thing. And what it simply means is there a better way of doing this? Or, you know, we could think of another way of doing this. How would we do it? For example, in our conference today, we could ask everybody to do something creative, right? We could ask them all to write 3 lines. We could get everybody to sing a song. These are the kind of disruptive and fun things that artists want to do. And they want to connect and they want to transform, just as Dominic said. To say that that's a part of well-being seems to me to be one of the most obvious things you could say. And the idea that, you know, a lot of the presentations have to kind of underscore this shows the difficulty of showing very, very basic things about a human being to systems. We'll head on into the next slide. So this is the head of Luke Kelly by the artist Vera Clute. And I can tell you that this was a highly disruptive proposition, because the very first thing that was said after the panel met by some politicians and officials is, where are his arms, legs, and banjo? And we are dealing with that all the time when we're thinking of creativity. We're dealing with, you know, what we're taught, which is that things have to make sense, and things have to be clear, and things have to be logical. Now, this particular beautiful piece is actually fashioned from Italian stone, and the hair is made from wire copper. And strangely as well, too, the bridge behind it almost looks like it was put there in East Wall and in Sheriff Street to complement the statue. But it's one of the most commented statues in the city, and it's also liked and disliked to an equal degree. And I think that's a very exciting thing for a work of art to create discussion. Like I think works of art that don't create that discussion, both likes, dislikes, and debate, are probably not that impactful because they're not offending anybody. And as Pasolini said, we should offend everybody equally when we do creative work. I'll go on to my next slide. So I'm talking here again about disruption, but this first statement, the statement on this slide is false, is the first line that my logic teacher wrote down in college. Because if the statement on this slide is false, therefore it is true. And if the statement on the slide is true, therefore it is false. So that's the kind of reasoning that an artist would be very attracted to, because it's full of paradox. And simply coming up with reductive ideas of how programs work is something I very much like to speak against and be a little bit controversial. That we don't have to have a reason to be involved in creativity. It's a natural thing to do. For example, some of the most important music of its time was written in the concentration camps. A lot of it was lost, but the urgency to create was really exacerbated by the living conditions of people there. And you would think that, you know, in the struggle for food, in the struggle to stay alive, in the struggle, you know, of violence, that people would turn away from the arts. Quite the opposite. That's when the arts become really, really important, because they remind us of what it is to be human. If you're being deprived of the arts, you're being deprived of an essential part of being human that does not need to be justified or to prove its impact upon how well you are. Now, of course, you know, children playing, if children get a chance to engage in complex play, I know as somebody who studies psychology, the impact that has on the brain, but who would stop children being engaged in play? Or who would ask them why they are playing? So equally, sometimes for artists, it's strange to be asked, why are you doing it? Because it's just simply a natural part. So this power of paradox, one of the great paradoxes for me as an Irish citizen is that Irish people seem to want private healthcare and public healthcare at the very same time. This is a paradox about, you know, the primitive and the caring that exists in people. So there are very definitely a wish to dominate other people, a wish to be hierarchical, a wish to have more control over power. And then on the other side, the switch is flipped to we wish to care for the homeless, we wish to support people who are poor, we wish to have a more equal thing. And this paradox is not debated enough. We either fall one side or the other side, instead of saying both of these things exist at the same time, and we have to hold it all within us at the same time. If you could move on, thanks. This is I'm sorry, I don't have the photographer credited, and I'll put his name into the chat before we finish. I was just looking for it there. This is a special commission under Creative Ireland that Dublin City Council undertook with the Gallery of Photography. This was to celebrate new communities in Dublin. So here you have, just wonderful example of someone from an Indian background. And, about 20% of Dublin now, people are not from Dublin. And yet we do not see this population in our art galleries, on our stages, or engaged in a lot of participation in the arts. I'm not saying not at all, of course, there's great examples, but we've a very, very long way to go to bring these new communities centrally into creativity and into the arts. And although we're a very welcoming nation and we do very well in the area of diversity, it is the key thing that we must achieve over the next couple of years. So this was a great example of a commission that was celebrating this. And we'll move on. Yeah, this is one of my favorite projects. This is a pandemic project last year where one of the arts officers in my office, Kelly Hickey, put together with these performers a play that could tour into the local authority housing complexes. It's called My First Holy COVID, one of my favorite titles as well. And you can see the children are here watching it, but everyone is watching from their balconies and socially distanced, like not having to move out of their homes. And I think the arts community responded incredibly well to the pandemic. There were festivals in vans, there were a tremendous amount of outdoor performances, and even recently, the theatre community and the visual arts community have really led the way in bringing guidelines into the creative practice and keeping everybody safe as they came indoors again. And we move on. And this is a very, very important thing to say. Everyone is creative. The idea that creativity is in some sense, trapped inside the arts and we have to try and get it is, I think, very false. And mostly too, it depends how you express your creativity. In my experience is which way do you think, right? So I deal with a lot of realists in my job. That is people who want evidence, right? So before I can, build a theater, people have to say, well, how many people will go and what will it cost and have you done the feasibility? So when you're dealing with a realist, it'd be very difficult to just say, I have this great idea if you can't back it up. And then, of course, I'm sure I'm surrounded by people who are pragmatists here that would get on and do the next thing and do it well, but always wonder what the next thing is to do. And the artists are normally what's called synthesis. So they like to make connections between very strange things, like between butterflies and hurricanes, between, certain kinds of music and certain kinds of food. They'll always be trying to make these strange connections. And then, of course, there are the idealists. And we all would like to have an equal society. But how likely is it that, that this is to happen? And will we be always disappointed? And do we need to commit ourselves vocationally to ideals, saying we'll get as far as we can, or just to be guided by them? And a lot of these people will occupy different parts of the brain. They'll be more dominant in that area of the brain. So obviously, left brain people, most companies are run by engineers or accountants. They're well able to plan and execute. Artists rarely run major companies because they don't like that kind of structure and they're not that committed to power or to gaining power. And this is a really interesting thing about creativity. A lot of the projects that we're being talked about today are projects in where you have to care, that you don't want power, you want to be of service. And that value underpins creativity because it is a joyous, childlike thing to be creative. You're not thinking about how it would be used to dominate. artists, of course, come from that I explore part of the brain and from the relationship part of the brain. And the most important thing is to build those relationships. And I loved looking at the various projects where people were actually building relationship for the sake of relationship, not for the sake of making somebody healthy, because it was a loving thing to do. Finally, maybe I'll just talk a little bit about the relationship of love and power. People often say to me, like, why aren't artists getting involved, or how can artists get involved here? And it probably will be because the artists haven't seen what I would call a gentle, inclusive invitation. They're being asked to write too many documents. They're being asked to compete alongside other disciplines that are far more dominant. And that sense of invitation, if you really want creativity to work inside somewhere, it's got to become the whole atmosphere that you create may have to change. If you're very focused on rules and regulations and procedure, it's very difficult for creativity to actually work, certainly for artists to approach. And so there are lots and lots of spaces. Artists really need space right now. There are lots of spaces, but artists won't feel welcome in them. And I can even talk about theaters that are very underused because of the lack of welcome that exists. It was one of the most important things we did, I thought, in Ballymun, was that from the time the person arrived into the building, or arrived at the back door if they were delivering a set for a play, they were made to feel intensely welcome. And this is because we knew that that's how our reputation would be built. So I hope I've given a little bit of food for thought to work in the arts in any way. Somebody once said to me, a life in the arts is a dream come true. And I feel very, very grateful, very honored to be asked to contribute today. Thanks.
Great. Thank you so much for that. That was Ray Yates, City Arts Officer for Dublin City Council. Thank you for all of the questions that have been coming in. We're going to take a few minutes for them now before we let you have a quick break. I'm going to start with a question from Camelia in our Q&A function, and keep the questions coming in there. Camelia asks, for any of the speakers, thank you for this incredibly inspiring symposium. It is magical and challenged at all the goes. What do you think are the next areas of innovation and pushing boundaries that haven't yet been tapped, that could be grown even more to have the arts create belonging and a sense of home both domestically and globally? In other words, what would you do next to keep this crucial momentum moving? And I might come to you first, Alexandra, and then Dominic, jump in there as well, please.
Thanks, Anya. So yes, I wanted to pick up on something Ray said actually about everyone is creative, and I think this is at the heart of where we need to go next, is really opening up that space, all of us collectively. And for me personally, one of the big ways of doing that, or the thing that I think we should focus on, is co-production. So the idea that it's really an interdisciplinary space, if you like, but particularly in the health space, bringing people who have lived experience of illness and who have experienced health services and bringing them into the creation of the work that we're doing. And another thing I think Ray said about relationships being at the heart of it, but I don't know whether, Dominic, you want to talk about the World Health Organization stuff around.
Yeah, I was thinking, to build on what you were saying, really, I think next steps has something to do with structural shift, with making things normal. So the WHO has just done some extraordinary work. It's appointed a creative arts lead, and amongst other things, he worked with Lady Gaga. He raised 250 million during lockdown that went to address the amount that Trump withdrew from the WHO. But as well as that, they've been doing a series of roadshows around the world. They just did one with the Met in New York, so a big cultural brand, if you will, lots of attention, where they talked about the role of creativity. They worked with MIT, with the neuroscience lab there, with the neuroaesthetics lab, and really what they're doing is trying to embed ideas into systems of support and delivery at scale. And what fascinates me about that is that this is a conversation that's been going for a long time. I'm quite inspired by places like Port Sunlight. And Port Sunlight was basically doing this kind of initiative a long time ago, giving people good housing with access to vegetables and stimulating meaning in their lives. And that was in 1888. So this is a long conversation, and this current iteration is just us carrying on and adding to it, but in the current context.
To stay with you, Dominic, for a moment, Angela in our Q&A says, Dominic, inspirational, could our, and I assume it's new HSE primary care centres stay open into the evening to become creative care centres outside of the core times? And she gives the example, very early mornings also.
Very early mornings and artists, maybe. I know artists that do early mornings. Artists are everybody, artists are everywhere. Yes is the simple answer. What I really like about that as an idea is it's this idea of putting artists and creativity into the heart of healthcare. But there's a long tradition of this, the tradition of art that's about naming ceremonies and birthdays and deaths and funerals and grieving. The art that's made around there has been going on forever. We've always made it. It's a living tradition like traditional music, and in a way, maybe it needs a little bit of tending so that we can make it normal in all of our communities. And at the systemic level, at the level that Ray works at and Alexander works at, it's how do we support the people that do that practice in a way that's important. It's not about taking numbers from a GP and dropping them on a community unless we support people to do that. It's trying to find a way to work across the multiple platforms and processes of delivery, whether it's housing or whether it's a formalised healthcare system or whether it's public health or whether it's the arts office. We've all got a responsibility for the sustainability of our own health and the health of our neighbours. And if the pandemic has proved anything, it's that's the truth.
Okay, thanks for that, Dominic. Alexandra, 2 questions for you, and there's a lot of links in these, so I will cross-post the links into the Q&A as well. But Kathleen asked, would Alexandra be able to give any reference to any research that might have emanated from the social prescribing project she mentioned? And a second one then from Caroline. Alexandra, can you tell us the name of the illustrator who you worked with, people who illustrated the lived experience of people living with dementia in Alexandra Coulter's presentation? Also, how is this illustrator funded to do this piece of work?
Yes, sure. In terms of the research, I think we've got some links to the social prescribing network, which is a bit of a repository for the research generally around social prescribing. The project I was talking about in Weston-super-Mare doesn't have a research project associated with it. We have produced a creative evaluation document, but which I could get the link for, but I haven't got it with me now. David Shrigley is the illustrator. That he's actually an artist. Those I refer to those as illustrations. And the Creative Health Inquiry was funded by Wellcome and the Paul Hamlin Foundation, and we paid him from our budget.
Very good, thank you for that. And I know you're typing in some links, and I'll cross-post some as well. Thank you for that, Alexandra. We have a question from Alan. And Ray, this might be one for you, but others jump in. Alan says, is there an unfortunate component that funding or money are detriments in the capability of the arts cultural sphere to continue and operate? If this is a factor, then should society or indeed the state ring fence funding for long-term projects, sustainability? It seems that community and voluntary sector is the one, and sorry, my screen jumped, is the one which gets cut when budgets are discussed. Ray, would you like to come in there?
Yeah, I find it difficult to talk about money because it's the first thing everyone wants to talk about. They kind of don't want to talk about the project, right? And I think the thing to do is to keep showing the value of what we're doing and to keep building the value. I think the value of the arts, was exponentially changed during the pandemic, and there's been about 100% increase in funding from government in the current year through the Arts Council and the department. So I think we just need to keep going. Let's get another 100%, by keep showing the value of it, and stop thinking in such absolute scarcity terms all the time. There's potentially tons of money if we think in a different way and show, the value of what we're doing. I'd be very optimistic, you know, not in a toxic way, I hope, but very optimistic about the future of what we could do.
Okay, thank you for that, and thank you for the question, Alan. We've a lovely comment in from Miri. I'll let others read that. I'm going to skip on down to, let's see, there's Tara and Darren. Maybe I'll come to Darren's question here, and give me a hand if somebody would like to take this. Darren asked, do the panel have an opinion on gaps between current climate demands of governance, performance measurement and accountability so prevalent in the public sector and the arts, the inclusion of voice and perspectives of the less powerful, and how we measure this in a creative and innovative way? Dominic, Alexandra or Ray, anyone like to jump in there? I know it's a biggie and we only have about 2 minutes.
Yeah, oh God, well, we're in the middle of doing one of those climate creativity projects with the people of Crumlin in partnership. And I've, you know, located 2 artists who are both engineers, because I knew exactly what was going to happen. We'd be attacked for not having data or not kind of understanding the scientific end of it. Look, climate change is a deeply political thing, and you know, we have to have as much, you know, global and big corporation responsibility as we do individual responsibility. But I think a lot of, again, everybody kept their carbon footprint very low during the pandemic, and I think a lot could be learned from that. And also our relationship to time changed, and we're giving it away again. We're giving away our time, I think, in frivolous ways again. So yeah, I think there are very innovative ways of doing this, and you know, it's all to play for.
Okay. Alexandra?
Yeah, I'll just add to that, because I think this question of the sort of challenge or the difference between accountability in the public sector and how the arts functions and can give voice to the powerless. And I mean, you know, it's very hard to tell what's going on, but I do think COVID has changed the way people understand the value of community and arts in the statutory public sector. And their eyes are more open and they're more receptive. And I've heard so many people talking about something called human learning systems. I don't know whether any of you are familiar with that, but it challenges some of those performance management and top-down governance structures that we've been so used to in the public sector. So I do feel change is happening, but it's complex and takes a long time, obviously.
Before we wrap and go to a quick break, Dominic, did you want to come in and anything final there?
I was thinking about Facundo Manes. Facundo Manes is a neuroscientist in Argentina who made the case that unless you invest in play for young people at very early age and creativity with young people, then actually the cognitive development of young people doesn't happen, and eventually in older age they're not economically advantageous for the country, so the country suffers unless that happens. Now, he can do that because he's got an incredible intelligence and a great long view. And that is undoubtedly a truism, but it's also not necessarily how this works for most people. And so I sort of think we need to use many different systems of complex systems analysis to analyze complex systems.
Okay, thank you so much for that to Dominic, Alexandra and Ray for all of your questions. We're going to take a very, very quick break. We'll see you back here in just 5 minutes. So it's 4:54 now. So 4:59, we're a little bit behind schedule, but I think it was worth taking everybody's questions. So recaffeinate, catch your breath, get some fresh air and be back here in 5. Thank you to all of our speakers so far. Now, welcome back. We've got some brilliant speakers coming your way shortly. Just a reminder, we'd love to have your questions continue to roll in the Q&A function. They've been brilliant so far. Anything we didn't get to, we'll try and come back to in the final Q&A. Reminder also, we'd love to get your social posts about the contributors and all of their contributions here today using the handles such as @RespondHousing and @GPHI_fellows and using the hashtag Brain Health and Housing. Now, the first of our 3 speakers coming up is Magda Kaczmarska, is a dancer, a choreographer and a creative aging teaching artist based in New York City. Magda has dedicated her career to utilizing the vehicle of dance to support changing narratives around agency, belonging and the right to self-expression. Her multidisciplinary work leverages a dual background in neuropharmacology and dance to build bridges between seemingly disparate sectors, devoted to building evidence base while expanding public and professional education and best practices in creative aging practice globally. Magda balances her work in intergenerational community-based teaching with engagement in advocacy. Magda, that all sounds truly wonderful. I can't wait to learn from you over the next 7 minutes. Thank you so much.
Oh, thank you, Anya. And thank you so generously to GBHI and Respond for the invitation to join this event. And thank you to the speakers who've laid the foundation for our discourse today. And finally, I want to thank you, the audience, for donating your time and energy to connect with us today. So I'll be speaking and responding from my lens as a community-based movement artist. In that capacity, I utilize dance and creative movement and storytelling that's inherent in our bodies and our minds to build community. I firmly believe that the arts are an integral part of the healthcare ecosystem, and that by engaging in co-creative arts practices, we're expanding our capacity and agency for promoting our individual and community health. By engaging in the arts, we're putting our brain health into our hands and our bodies. So today we're talking about communities and built environments. And environments are invigorated by the people and actions that take place within them. In order for a product or space to have meaning, we have to invest in process and co-creatively infuse the voices of the community into the space. So when I think of entering into a community, I first think of that space. How can I facilitate the creation of an egalitarian, accessible, inclusive space? An intentional container that's fertile and receptive to connection. Next, I think of the people. Who will populate this space? What are their needs? What are their current tools for connection and expression? And what constructs are hindering their meaningful connection and expression? And then finally, I think of the actions, the process that will facilitate their communication, expression, and connection. And the process that I utilize to do this work is co-creative embodied storytelling, storytelling using dance and movement. Now, dance and movement is a universal language. We can all discover and hone our abilities to listen and express in a more embodied and holistic fashion. Our storytelling need not be limited to spoken language. We can use dance, movement, and gesture to tell stories with our bodies. And this is especially vital for people who may be experiencing shifts in their modes of communication, like people living with dementia inevitably do. Amplifying these alternate modes of expression opens up opportunity for meaning making and connection. The aim is to see and hear one another, and creativity inherently facilitates that in expanding our tools of listening, seeing, and speaking. And here I'm struck by something that Dominic Campbell said at the end of his presentation, the quote from Sean Miller. We're told, I quote, that there are important stories and there are unimportant stories. And I suppose what I'm saying is that all stories are important. And I want to amplify that. Each one of our stories is necessary. The arts facilitate expanding tools to tell these stories. So what is co-creativity all about? It's about seeing and acknowledging our shared humanity rather than a diagnosis. It's about opening doors and windows and making corridors and bridges. It's about finding unity in seemingly disparate experiences, recognizing that we are much more alike than we are not. It's about being confronted with our implicit bias and then teasing it away through experiences in shared space. It's about celebrating all the voices and all the stories. This is community building. Most of my work at this time involves partnering with communities of people living with dementia to co-create meaningful community using dance and movement. For the last year, I've had the incredible privilege of joining with numerous communities virtually in the US and beyond, like the Dementia Action Alliance in the United States and the Forget-Me-Nots Choir in Ireland. And I had the incredible privilege of just finishing an in-person 6-week residency at the New York Memory Center in Brooklyn, New York, where over the course of 6 weeks, I got to connect in creative expression with 23 people living with dementia from diverse backgrounds and spaces. And my observations of our time spent together highlighted how this approach facilitates a collective feeling of safety, ownership and enjoyment of creative exploration and expression. At the beginning of this time together, people got tired fairly quickly, by halfway through of our time together, which lasted about an hour. Connection was curious and generous, but also hesitant and sporadic. By the end of just 6 weeks, meeting twice a week, every one of the members was joining for the entire hour, which often extended to 75 minutes due to the extent of interest and contributive ideas. And this further extended into another hour of social time that involved spontaneous song, conversation, suggestions for music to be played, dance, which all served as an extension of the themes that we explored together, but also as evidence of the impact of the experience on the interconnectivity, satisfaction, and well-being of this group. The dynamic feeling of community, feeling of openness, contentment was palpable. And that interconnectedness, that weaving of exploration, curiosity, patience, generosity, playfulness, that is what co-creative movement and storytelling is all about. Our engagements don't just create fun and creative space, which is vital, but they're integral to amplify and support the relationships that are already existing in communities and helping build new ones. Here, I'd like to reference something that Alexandra Coulter shared in her presentation. Arts help us make meaning in our lives. I'd like to add to this that arts amplify our contribution to larger meaning making. Arts reflects to us how much value we contribute to community just by being in it. We are all integral to a community. We make community. I'm delighted to have actually just received funding from the Global Brain Health Institute and Alzheimer's Association and Alzheimer's Society UK to now bring this approach to virtual iteration in 3 communities in the United States. The aim of this will be to expand this co-creative movement practice to facilitate community building in these spaces, but also to infuse the voices of these individuals, the experts on the lived experience of dementia, into the design and future growth of this work. So this impact doesn't just galvanize, amplify, and build community within marginalized groups. It also helps us break down these artificial barriers that have siloed and distanced these groups by changing narratives and untangling stigma. Dance, co-creative movement, and storytelling gives us a resource to connect and build more empathic, healthier, and integrated communities together. Thank you so much for this opportunity. I look forward to having more conversation with you in the Q&A.
Magda, thank you so much. Magda Kaczmarska, teaching artist and Atlantic Fellow with GBHI. That was brilliant and sounds like such a wonderful session in Brooklyn, in person, as you say. Anyone with questions about all of that, do get them into the Q&A function. We'll hopefully have time for Magda at the end. Up next, we have Karen Meenan. She's also an Atlantic Fellow for Equity in Brain Health and is co-founder and director of Lewy Body Ireland. She's the founder of Making Here Reminiscence Theatre and a volunteer with the Forget Me Nots Choir. She's a volunteer researcher, broadcaster and producer of award-winning dementia-inclusive radio programmes at Near FM in Ireland and LLARC in the UK. Karen has recently been appointed PPI and Communications Coordinator in the newly formed Dementia Trials Ireland DTI. Karen, you're very welcome. Looking forward to your words. Thank you.
Thanks so much, Anya. God, that was a bit of a wordy welcome. I didn't realize I had written such a bio. And thank you all so much. I'm delighted to be here in such fantastic company this afternoon. And as Magda said, thank you all so much for the speakers who've already gone before me and those who are to come. And more importantly, for your time. This is a big ask on a Monday to give up your afternoon. But, you know, so far it's been so worthwhile. So I'm just so delighted to be here today. There is a little video that I just want to share with you. It's a tiny one. It's 30 seconds. Ronan, would you mind sharing that video and then I'll give you the context of it. Thanks, Ronan. So that is a tiny little video and I'm going to just share it in the chat as well so you know what it's about. I do a radio show. Every week it's a different theme And usually the theme usually is something to do with dementia. So my background is my mom had Alzheimer's disease. So that's my huge interest in dementia. And to be honest with you, before I joined the folk in GBHI, I had thought that memory and dementia were all kind of the same thing. I hadn't actually realized, even though I had heard of other things like vascular dementia and Lewy body dementia, I had heard these, they were kind of in the back of my mind, but I hadn't actually heard the distinctions between them all. So when I learned that Alzheimer's was 60% of all the dementias, I thought, well, that's curious. What about the other 40? So that's when I got involved with all these other magical people in GBHI and around the world. And we were on Zoom. So we did our program through Zoom. And in many ways, while we were disappointed we never got to meet, Maikta, I've been working with her for a year and a half, which is phenomenal, but I've never met her in real life. Does it matter? No. And that is the mad thing, is that this pandemic has given us a gift. This gift I bring you, it's the present. So we have now this forum, we've Zoom, we can connect in a way that we never thought would be possible. Who would have thought we could have a Monday afternoon sharing our time and our talent and our energy with people from New York, from Brooklyn, all around Europe and in the UK and in Ireland? We wouldn't have thought it possible, but now we're doing it, which is wonderful. So when the pandemic struck in March last year, I'm the founder member of the Forget Me Nots Choir. It was set up by my sister Orla Horn for our mother, Kathleen Tierney, who had Alzheimer's. And originally it was set up as a little, you know, a place for a mum to go where she could sing old songs, try and relive some of the memories that she had. She had been a great lover of poetry and a great lover of music. And when she had the early stages of dementia, she lost her conversation, but she never lost her love of singing. So when we set up the choir, one of the art projects that we wanted to do was to make sure that it was quality project, that we learned harmonies, that we learned new songs. It wasn't just kind of like a sing song, which is fine, and sing songs are great, but this was to try and learn new songs, new harmonies, and put them to settings. So when we got to March 2020 and we realized we couldn't sing together anymore, we thought we got to get people on Zoom. That was the first challenge. We have 130 people in the choir, a third of whom have dementia, a third are caregivers, family members, and another third are people who are kind of volunteers or people who like to sing. So that was the first challenge. How do we get all these people on Zoom? Originally, people said, no, it's too hard. We'll just have to call it a day. We'll wait till everyone has a vaccine. We'll get back to Baldoyle Community Centre. We start singing it together. But that was, you know, an impossible situation. How could we wait 6 months, maybe more? So we came up with the idea of doing a video. So I made a video and it had to pass what we called the Canis Kelly test. So Canis Kelly is one of our gorgeous members, a retired gentleman who used to run his own company. So when I made the first batch of the videos, I said, this is how you get on Zoom. This is how, and I thought it was very explanatory. You know, this is the icon that you look for. This is how you download something from the App Store. And Canis, each time we did a draft, he said, no, that doesn't work. You got to go back and do it again. He says, if I can't get on it, who can get on it? So there were 5 iterations of the video. And eventually it passed the Canis Kelly test. So that's something that's gone into our lexicon. Does it pass the Canis Kelly test? Is it simple enough for somebody who lives with dementia or any other disability, or in fact, just anybody? Can they all follow the instructions? And if they can, great, we've made it. Then we had people saying, well, you know, it's a big ask getting people on Zoom. They mightn't have a laptop. They mightn't have a smartphone. They mightn't have an iPad. So then the call goes out to all the people, you know, who are sons and daughters or family members of all the members saying, well, have you got an upgrade due? Are you going to get an upgrade of your smartphone? Can you give your old smartphone, the one that's in your drawer? Can you charge it up and give it to your grandparent? Can you give it to your parent? Can you give it to your neighbor? And this became the conversation at the early stage of 2020, with the result that we regularly had more than 100 people on Zoom, not just once a week, which we had in the community centre, but we had twice a week. Our rehearsals on a Tuesday were the same ones as we always had. We learned new songs, we learned harmonies. We started off with wonderful exercises, you know, to get our bodies moving, to get our voices moving again. And then on Fridays, we had this wonderful new idea, how to bring some creativity, extra creativity into a session with people who had never been on Zoom before, many of whom have dementia. And so this whole lovely experience on Zoom, a 90-minute session was born. So the 90-minute session, what was it all about? It was a little bit of learning for everybody. So we had a different theme every week. A theme might be Gilbert and Sullivan, or it might be, you know, songs from the opera. It could be Eurovision hits, or it could be Johnny Logan, or it could anything at all. What was the theme? How did we get the themes? Well, we asked. Like any good marketer, how do you know what's going to work? You ask the question, what do you need? What would you want? And then you give it to them. So we asked our members, what would you like to hear? And it was anything from parlor songs to songs from the 60s to songs from the 80s, and, you know, and a little bit of learning in between. So there was, you know, some classical stuff that came in between. And then we introduced some dance and some movement. And that's where we met Magda, who did some lovely dance sessions with us as well on storytelling. But a very important element of these Friday sessions was poetry. So this is where the element of poetry came in. We discovered that there are some of our choir members who don't really want to sing. Singing in a group in the community centre, but not singing live. They shared poems that they wrote, poems that they love. And this is where they gave me the idea for our radio station. The radio program on Near FM is, you know, there are 4 now iterations at this stage. The first one was Reminiscence on the radio. And each time I ask a guest to choose a favourite song, a favourite poem, and the reason why they chose those ones. And then I'd ask them obviously about their work or their experience or a special year. And it's funny, they sound like really simple things to do, creativity. What's your favourite song? What's your favourite poem? It sounds like a simple ask. It's not, right? You know, your favorite song, mine can vary from day to day or from minute to minute, depends on my mood. Depends if you ask me on a Friday evening, totally different song from a Monday morning. But if you ask somebody to share this with you, that's where you spark creativity. So the little video I shared with you just at the beginning, this was the result of a workshop I did with Kunle Adewale, who did the portrait behind me here of Kevin Quaid. This is another guy who has huge creativity. Kevin Quaid is a guy who lives with Lewy body disease. He's co-founder of Lewy Body Ireland. He wrote a book. He never wrote so much as an essay when he was in school, and that's his second book. So even when you have a disability or you've been diagnosed with a life-threatening condition like Lewy body disease, you can still be creative. It doesn't matter, you know, whether you paint or whether you draw, whether you sing in a choir or whether you write or write a poem. Everyone has a little bit of creativity. It's just we allow ourselves the license to do this. So this haiku, I want to share it with you again. It's by a poet called John Killick. This gift I bring you, please handle it carefully. It's a present. When I shared that video with this lovely group who are in Lagos in Nigeria, this person, Ifowella, who lives with disability, she's an albino in Lagos, but no later than 13 or 14 minutes after we said goodbye on a Saturday 2 weeks ago, she sent me this video of her holding her hands like this. We had learned how to do this with a previous speaker who shared with us a special piece of dance music that she had learned in India. So this is a special gift I give to you today. This is a gift of peace and a gift of a song. Thank you so much for your time here today. I'd love to connect more on questions and answers on how to be creative, even if you don't think you are. Thanks, Anya.
Thank you so much for that, Karen. That was superb. That was Karen Meenan, Director, Lewy Body Ireland, PPI and Communications Coordinator with Dementia Trials Ireland, and Atlantic Fellow with GBHI. And if you have questions for Karen, do get them into the Q&A function. We'll hopefully have time shortly for them. Now, our last speaker of the day before we go to closing remarks and Q&A is Jess Jekko Dunme. Apologies, Jess, for butchering that. Is a design historian and an innovation designer. Her career has zigzagged across continents and sectors, for profit and for non-profits, as the Director of Human Sciences Studio at the Doc, Accenture's flagship global R&D centre. She spends her working hours asking why, how, and so what about people, society, and technology. Jess is a co-founding member of Beyond Representation, an organisation championing women of colour who are breaking new ground in Irish media, arts, and business. So Jess, you have some inspiring words for us, no doubt. Take it away, please.
Thank you so much, Anya, and thank you to all the other speakers and the audience here. It is really a privilege to be invited to respond and contribute to this conversation. And listening to everything I've heard and thinking about the work I've done in my current role in the Human Sciences Studio, but also in previous roles, there are 3 things that I'd really like to kind of offer to the group in response. One is the idea of a social artist. The second is the trap of othering others. And the third is the role of the social imagination. And to take the first one around the role of the social artist, when the question was really posed about how can the arts play a role in boosting or bolstering community and creativity, and I really spent time thinking about the arts, that word, I think there is a division that we often see between high art and low art, and a certain sense of high art being a static repertoire of arts in our society, one that often feels like you need a certain social permission to enter over the boundary of a museum or a theatre. But what I think we're hearing a lot about here is more street level, community based social art, where actually the power within that is in the interaction between those experiencing the art and the artist. And that power comes from not just the creations of the artist, but actually engaging with the creators themselves. And we've heard that through all the stories today and all the case studies. For me, that offers a different part, a different response for the brain. I am not a neuroscientist, so I've said the word brain with a big pinch of salt there, in that this is not scientifically a response. I'd love to invite anyone from the audience who has perhaps studied this, but that interaction with the artist as well as their creation is what I mean by that social artist. Academic Richard Florida wrote a book called The Rise of the Creative Class, and he talks about how creativity flourishes in a very unique kind of social environment, one that is firstly stable enough to allow for continuity of effort, but one that is also diverse enough to nourish what he described as subversive forms of creativity. And, you know, listening to Ray talking about the artist as a disruptor, I was very much reminded of that. These two things are needed all the time. And it's not just about one type of idea of art. So the second thing I said I would mention is this idea of the danger or the trap of othering others. And I think it's very easy to sit from a certain perspective and think about old people, immigrant people, poor people in a way that is incredibly dismissive. And there are two examples I would like to offer to you as a way of breaking through that, and also to show the role that art can play in breaking through that trap of othering others. One is something called Uninvited Guests. I will share the link, but I would encourage you to look it up, by an organization called Superflux. Complete disclaimer, I have nothing to do with this project, but I think it was very powerful. And this really looked at the tension between what technologists and innovators often kind of see as solutions to human needs. The sense of where does the agency lie between something that we create in a technological solution and something that people need. It very much reminded me what Linda said in her opening about how technology and smart homes can replace forgetting or replace remembering. And this video tells a story of an older gentleman called Thomas, who essentially is given all these smart objects by his family as a way of looking after him, but he eventually games the system. And I think we all need to be reminded that humans are messy, we're unpredictable. You know, there's a certain amount of, you know, whimsical nature to how we respond to our environments. And I think that when we are thinking about solutions to brain health, that often artists can play a role in kind of blasting out, well, actually, there are unpredictable ways, unintended ways of responding to these solutions, and let's think through them. The second example in terms of the danger of othering others is one that I would, that was very privileged again to be involved with this group in Sligo called Uprooted. They were a theatre group who primarily came out of a direct provision centre in Sligo called Globe House, and they worked with broken talkers, and they created this experience that was meant to be put on, but during COVID actually became a short film. What was really important here is the role of arts in that case was to enable people to tell the stories in their own words. And as somebody who is coming from another country into society, that's a very powerful thing. They spoke about how it helped them to process their traumas, how it enabled connection within the community, and also to build trusted connections in that. It reminds me very much of what Dominic and Alexandra were talking about, the resilience. And I was talking to one of the ladies who was part of this theatre group, and I asked her about, her experience about, getting involved in the theatre. And shame on me, I had assumed that this was her first time being involved in a theatre group. And no, she told me that she had been on stage many times in Nigeria, and that this was, second nature. She enjoyed the return to the theatre, not a new form of art. So let's not forget that many of the people that we hope to work with may indeed already have a creative history and an artistic history. And the very last point, I know I'm going to wrap up now in a moment, is around, and actually I'm partially inspired by this from something Alexandra and I were talking about a while ago about boundary spanners. And I think this is talking about the role of the social imagination. We have a collaboration with the Institute Without Boundaries in George Brown College in Toronto. And they've done a project called Future Ways of Living and Aging in Place. And what I think is really interesting about this project is that they approach it, not just from an interdisciplinary group, but about this idea of anticipatory design. And if you think about that word, to anticipate and to think through what future needs and future situations might be, it requires an imagination. And this is where interdisciplinary teams that include artists and designers are absolutely critical, because we need to have that imagination, to spark that imagination, to think ahead and think through that. So the role of the social imagination, I think, is also really critical to consider in this conversation as well. And so I will leave you with that, and maybe just reference briefly how Dominic spoke about iterative learning. And I think when we're drawing on academics, artists, activists, architects, it's not just about iterative learning, but also cumulative learning. How can we learn from all of those different experiences and bring them to one, so then we iterate again together in the future? So thank you for listening. Looking forward to your questions.
Thank you so much, Jess Jacko-Dunmee, Director, Human Sciences, Studio Accenture. As usual, and I've heard you speak many times, Jess, you have managed to take 2 hours of conversations, find all of the threads and pull them together so neatly and beautifully there. I will be thinking a lot about that idea of anticipatory design and iterative learning that goes with it. So thank you for that. Beautifully said as ever. And we've some questions coming in. Anyone who does want to ask Jess, Magda, Karen some questions, we have a few minutes before we close out for the afternoon. Magda, I'm going to draw you back in for a question from Angela, and she asks, how do you engage with those who might be most reluctant at first, but are those who potentially will benefit most? I'm sure you come up against this a lot.
Thank you, Anya. Thank you, Angela, for that question. And I actually have 3 thoughts on this. The first one is, let's untangle that reluctance. Where does reluctance come from? What does it mean? I think for many of us, it means fear. It means stigma. Some of these implicit biases that we have against ourselves. What can I do? What do I have permission to do? And do I belong? Does my voice belong in this space? So, and that is not something that somebody can or should be forced into. To force somebody would be traumatic. That needs to be something that happens. Dominic talked about this, I believe. Ray also mentioned this feeling, the need to feel first and then to know. So this is where the arts and movement-based practice facilitates that. We move, we feel, and then all of a sudden we recognize that we do belong and that we do have a voice that is heard and respected. Part of that is also the variance of participation. That participation doesn't always have to be active. We can hold space for one another and be just as equal participants. And this also brings me back to that idea of co-creativity, which I think Angela sort of mentioned a little bit in the response earlier. This direction to head moving forward, where all individuals are egalitarian, they're contributing to the creation. So one person might suggest something that is verbal, and then another person can help contribute a movement, and then they have ownership of that together. And that is a way that that energy can cumulatively, as was just mentioned, over a sustainable period of time, help build a fertile space where people feel welcome and where their voice, it has a space to land.
Okay, great. Thank you for that, Magda. We had an earlier question we didn't get to, and I know Dominic is still with us, Ray, our earlier speakers, and it was from Tara. And any others, please jump in on this or the broader point. And Tara at the time had asked, has the idea of including creativity, the arts, as a stipulation for planning of new development for the benefit of future inhabitants at a national level, i.e. the Planning and Development Act, being considered? But I think it comes back to this question of just being proactive and forecasting our needs and allowing for it. Would anyone like to come in there? And this is probably just goes to, again, the long-term thinking and even what Jess is talking about there about anticipatory design. Would anyone like to pick up on that just before we close out? Ray?
Yeah, that's a big part of my job is liaising with the other departments of City Council about what we now call artist workspaces. And we have very much, gone into the area of co-design with the artistic community. Again, it comes into the paradoxical problem that you can't just say, you can in some art forms say, just give us this size of a box and we'll be okay. In others, you have to think about the kind of venue, like which art form, and it is complex, it takes time, and it takes deeper thinking. And that's not, for people who are trying to get on and get something done who are not from your discipline, that I think this tolerance, this inhibition of our expertise is really what we need to create a shared space. But yes, it is part of planning, and planning gain is achieved by creating cultural, community, or artistic facilities.
Okay, thanks for that, Ray. Anyone else like to come in there? Give me a hand if so. No, we're good for now. Okay, great. Okay, well, look, to keep us moving along, I'm conscious of everybody's time. I'm going to move on for our closing remarks now to Brian Lawler. And Brian is a professor of old age psychiatry at Trinity College, Dublin, and Deputy Executive Director of the Global Brain Health Institute. He's a geriatric psychiatrist with an interest in dementia, late life depression, loneliness, and brain health. Brian has worked for over 70 years in developing services and delivering care to people with dementia. His research interests range from early detection and prevention to evaluating new treatments for dementia. Brian, you're welcome. You're going to close us out this evening.
Thanks so much, Anya. And wow, what a session this has been this afternoon. I think we probably need someone a little bit more creative than a geriatric psychiatrist to capture the depth and breadth of the conversations that we've had today. But we started with a number of questions. The first question was how we might be able to use creativity to build brain health friendly communities and improve our health, well-being, and productivity across the life cycle. And what is the role of the arts in promoting creativity and brain health, and how can we embed creativity into how we design our built environment? Well, I certainly think we've moved the dial on a number of these questions, but I think this is still just the start of the conversation. But just to begin with the Provost and Declan, who did a wonderful introduction. And I think for me, they highlighted the importance of interdisciplinarity and diversity as a key contributor to creativity and creative practice and innovation. And I heard about the importance of the concept of home and making home. And I was reminded of Respond's, I suppose, approach to home first. You must get people home first, provide them with a home if you're going to help them heal, and how the sense of identity, safety, security, and connection are there if you provide a person with a home. It's so crucial to support people at home for as long as possible, and the negative impact of removing people from their home can damage their brain health, and really the importance of promoting brain health and getting people home to their family and community as soon as possible. And I think we've seen that very much during COVID-19, how isolation harms and connection can heal, and how social connection in your community and home can protect the brain and protect your brain health. So Dominic spoke about arts and how arts can help build a new republic of care, and how we must embrace creativity and the arts for health. And he gave some very wonderful examples of this new republic. And I remember in particular, I was there at the time, the concert with the National Symphony Orchestra at the National Concert Hall, and the music of Sean Miller celebrating the Bluebell Initiative as a great example of building a new republic of care. And the importance of how everybody's life and history must be celebrated and valued. Alexander Coulter emphasized how arts and creativity can improve health and well-being. and how arts in particular can provide a solution to address the health of those who are disadvantaged. And just to quote what she said, social determinants of health are mutable. Poverty is not your destiny. Enriching environments can enhance cognition and mitigate the effects of social deprivation. She also talked about how arts can make meaning of our lives, and this meaning can help us feel better. And that segued very nicely into Ray Yates, who talked about how often we don't have a language to communicate our difficulties, but arts and creativity can help provide us with that expression, help us work through grief, through trauma. I also loved what he said about arts for health, yes, but arts is primarily for the human experience, for human connection. And human connection is so important because connection heals. And then we had wonderful discussions from Karen and Magda and Jess. My take-home messages from their presentations were about how the importance of creativity for everyone. Creativity is for everyone, and everyone is a creative. The importance of co-production and working in the interdisciplinary space, and bringing people with the experience of the health system into the process. Also the importance of interaction, the creative art, and the importance of interaction between the person and the artist, and how creativity and the social imagination enhances empathy, and how creativity and art can disrupt this sense of othering, and again, is a means for connection. So just finally, just to wrap up, I'd really like to thank all our participants, and thank you, Anya, for being a wonderful MC. I'd like to particularly thank the staff at GBHI and Respond that really made this happen, because it's been a huge effort and I guess a great collaboration. And I think what was said at the outset by Declan and by Linda, it's quite an innovative collaboration that we've started here between Respond and GBHI. And I think that there's an awful lot that we can do in terms of moving forward in brain health and housing, and improving the quality of life of people right across the life cycle by bringing creativity to this space, in terms of looking what we can do with the built environment, with embedding creativity and creative practices into our communities, into the built environment, for the betterment of health and to improve our well-being. So once again, thank you so much. I'll hand back now to Anya.
Thank you for summing that up brilliantly. That was Brian Noller of Trinity College Dublin and Deputy Executive Director of the Global Brain Health Institute. That's all we have time for. We've heard so many creative ideas today that I think we're really grounded in all of those ideas of creating connection, community, and as Brian talked about there, repeating the words of Dominic earlier about creating a new Republic of Care. To answer the question from Katie in the Q&A function about a recording, and she did say, and I'll share this with all of our speakers, this was so inspiring, so much inspiring information. I've been a senior healthcare interior designer for 20+ years, so I hope that was shared by everybody who tuned in today. But a recording of this webinar will be available on the respective websites over the coming days and weeks, so do keep an eye out for it there. All that's left to say really is thank you sincerely to all our speakers, presenters, panelists, the team at Trinity College Dublin for facilitating the event today. There will be more seminars in this series, so again, keep an eye out for more updates from Respond and the Global Brain Health Institute. Really, everything has been done and said, so many inspiring stories and case studies today. I do wish you a lovely evening. Stay safe, stay well, and talk again soon. Thanks for joining us.